The French government is looking at different options to try to avoid having to put the entire country on lockdown. The first option, of course, would be to extend the current curfew that's established between 9 p.m. and 6 a.m. for 2 and 3 French people. They could extend it geographically or also time-wise. They could also decide to impose a lockdown, but only during weekends. And the third option would be to impose a lockdown on the entire country, as what happened back in March. They're doing so because the number of cases of COVID-19 diagnosed every day is increasing exponentially, and they want to avoid hospitals being overwhelmed with patients. We know that there aren't enough beds in intensive care units. As of now, there are about 2,500 people in intensive care units for about 5,800 beds. Now, the health ministry has promised to increase the number of beds to 12,000, but we haven't seen any of it yet. And the situation is even more tense this time around because the entire country is now concerned by this COVID-19 pandemic, whereas back in March, only 2 to 3 regions were considered as COVID-19 hotspots, and transferring patients from one hospital to another at the time was still possible.